Okay, well, welcome everybody to another Friday. We're happy to have you here. And we are also happy to have Drew Polish with us. Drew is going to be reviewing for us what I think is a very exciting product, especially because of the pressure that the Medicare market is in to start transitioning from agent to individual Medicare sales to agent to business Medicare sales. And this product is very exciting. I think it is at the forefront of what we're going to see happening very much in the future. And we are going to be publishing this. We also have, and some of you may have seen this already, but out on the Medicare plan details where we have all the carriers, we actually have the Fenyx carrier out there. And we have a lot of their brochures and presentations, and we have the videos out there. We'll have the videos on the YouTube, but it is a way for you to go back and get information if you somehow miss something during this presentation. So without further ado, Drew, let's have you.
Wonderful. Thanks, Doug. Pleasure to be with you guys. Drew Polish. I'm the Chief Sales Officer for Fenyx Health. Had a little bit of a cold lately, so bear with my voice. Maybe it'll sound better recorded. I don't know. But super excited to.
It sounds pretty good.
No, good. Super excited to visit with you. I grew up in Elko, Nevada, for those that are familiar with rural Nevada. I currently live in Blackfoot, Idaho. It's where my wife grew up, and we love it up here. So Fenyx Health is the insurance carrier. We're a new carrier. We offer a group Medicare Medical Savings Account. So I'm sure most of you guys probably have had a couple questions about MSAs on the AHIP, right? Sometimes that's all the information agents have. So we're going to talk through specifically our product. This is why we're not getting CE today. And we'll touch basics of Medicare. You guys are experts. We don't need to spend a ton of time on there. But then also the MSA basics, what's different on a group chassis specifically, like Doug was talking about, and then how our product and some ideas, some strategies that we've developed that we think are pretty unique and cool. So super excited to be here with you. Just Medicare Essentials, we're all familiar with that, right? When we're eligible, the 4 parts of Medicare, we don't need to go over that. Effectively, right, what we've had in the Medicare market is the traditional plan options. You can choose to either purchase a supplement, Medigap policy to help cover the A and B expenses that are not. What's great about a supplement, no network, right? You utilize Medicare's network, go anywhere in the country. You've got that flexibility of having a standalone Part D. Some of the challenges is they are getting more expensive, unfortunately. And in some cases, I will point out, Utah and Nevada, specifically, if you're under the age of 65 and you're on Medicare because of a disability, you don't have the opportunity to purchase a supplement. And there are several counties in Utah. There's a lot of counties in Nevada that typically have not had Medicare Advantage plans. And so those individuals have been a little stuck, right? Your second option, of course, is the Part C, the Medicare Advantage, which usually includes prescription drug coverage. A lot of them are no monthly cost, right? You get all the extra benefits. We see the commercials every year. Some of the challenges is network. They're very much network driven. You got to have prior authorizations. You have to have referrals, right? So we're excited to announce our group Medicare MSA. It's an MA only, so MSAs are MA only plans. Prescription drugs actually are purchased separately, and you can and you should purchase a separate Part D because you want to have creditable coverage. But there's some unique features with an MSA. One, it's zero member premium by law. So zero premium is not new to Medicare Advantage. There's lots of great options in Medicare, but it's zero premium to the member by law. That's not something that we as a carrier can adjust. The other unique thing about an MSA is, although it is Medicare Advantage, it literally is Part C. There's no contract with providers. We literally use the Medicare network, and we pay as Medicare pays. So you have access to any Medicare provider in the entire United States. Now, they do have to be willing to bill Fenyx Health because we are processing the claims. As long as they bill us, we literally pay them what Medicare would pay them, and we'll talk more about how that works. It's pretty cool. I put in quotes here, right, that this is a new option because MSAs are not new, right? They've been around since 2007, 2008, but no one's ever offered it on a group chassis like we are. And we're the only ones in the entire country that have this right now. So it's pretty exciting. Also with an MSA, one of the ways to understand an MSA is by thinking of an HSA, right? So with health savings accounts, you or your employer can put money in a special tax favored account. With an MSA, what's unique is you actually get deposit money from the government. So one of the only Medicare plans you can actually earn money on. We are required to cover all Medicare A and B services, right? Just think original Medicare. If it's covered under there, we're supposed to cover it. You'll have a deductible. We'll work through all that. And the other unique thing is we actually don't require prior authorizations or referrals. So it's kind of this unique Medicare Advantage, but feels like original Medicare or a high deductible supplement. And we'll talk more about that, which is kind of cool. This next slide, we don't have to read all these. It may be a little small. If I blow this up, because let me see if it gives you guys a little bit better view. Does that help? I think it's a little different on my screen how it shows. Nonetheless, one of the differences between an HSA and an MSA, in the HSA world, you have a qualified health plan, and then you also have your custodian, your MSA account. Those are separate from each other. With an MSA, it's one and the same. So Fenyx Health, we are the insurance carrier, we're the payer, but we're also the banking component. Now we partner with custodians, with banking partners. Optum Bank is currently our largest custodian that we work with. We are able to work with other custodians or banks if they would want to. So that's one thing that's unique. The other thing is the money that is deposited into an MSA has to come from the carrier. And we receive most of that money, all of that money initially from the government. We'll talk about how that works. And then in our other strategies, we'll show you. So pretty cool. The money that you have in your account is meant to offset your deductible, but it's your money. You could literally spend it on any qualified medical expense without taxes, or you could spend it on anything. It would just have the tax consequences, right? That's between you and the IRS. So kind of cool. Some eligibility requirements, right? I always tell people, I think I told Doug and Nancy this, as much as we love our product and think it's very unique, it is not the right fit for everyone, okay? And in some cases, you're not even allowed to enroll in the plan. So you do have to be eligible for both Medicare A and B. You have to live in the United States for at least 183 days or more. You're not allowed to have other coverage that would pay before the deductible. So you can't be on group insurance, the TRICARE, the VA benefits. Now that's different. You can be a veteran and not be signed up with the VA benefits, right? But if you are signed up with the VA benefits, you'd have to waive that. Probably don't want to do that. Of course, if you have your federal benefits, then we're not allowed to enroll you, right? If you're eligible for Medicaid, right? So if you're dual eligible or not, if you're dual eligible, then we would not be able to enroll you. That's different than LIS. So you can still be eligible for the low income subsidy and sign up on our product, but if you're eligible for Medicaid, then no, full Medicaid. And then the only other question we ask is if you're currently receiving or currently on hospice. then we're not allowed to enroll you. If you're our member and you go into hospice, that's different. But if you're currently on hospice, we can't enroll you. So there are some situations where it's like there's great products out in the market. Ours is probably not the fit for you, right? Okay, you got to, I'm going to try to watch these. I can't always see, but yeah, if you have a question, let me know right away. I want this to be interactive. Yeah, or just pick up. Yep, go ahead.
So with the Medicaid, if they're like SLMB, like if they're getting their Part B premium, but they're not full dual, or like the spend down, would they qualify for something like this?
Yes, yeah, they should. It's just the full dual eligible, no, because you've got your D-SNP plans out there for that, right?
Yep. Okay.
The CMS is looking at it as we're already giving you all of these benefits. Same with the VA. We're not going to then give you cash in your pocket. Okay. Although the LIS, the low income subsidy, you're getting some benefits there. It's offset. So okay, cool. Good question. Now, Drew, go ahead.
Since Colette jumped in with the question, I'm going to jump in with my question right now. So It sounds like you don't work just with Optum Bank, but the beneficiary could actually choose to have their deposit put into their bank. Do they do that during the enrollment? Is there an option there where they can stipulate the bank that they would like you to work with, or how does that work?
Yeah, thank you for allowing me to clarify that. So our main custodian is Optum. You as the consumer do not get to decide individually who you want the bank to be, because we set that up as part of your application. You literally give us permission to set up the bank account. We do require your social security number. We do require an email address separate for a husband and wife because of the banking disclosures. But for example, Doug, if a large entity wanted to go through a different banking system, we could have a partner with, call it Mountain America, for example, or Idaho Central Credit Union or Health Equity, right? We could have other partners that we could say, here's your option for the bank, but individually choosing, no, that is not an option.
Okay. So it's sort of how influential is the group is basically. Okay.
Correct. Yeah. And again, it's who we're working with, right? Just to let you guys know, we have been in talks with Health Equity. We have not signed any type of contract or anything, but we are working on other relationships to have other opportunities, right? So, and there may be a group that we work with that says, well, geez, our HSA is already with, American First or whomever. Is there a way that we could and then we could say, you know what, that's feasible. Let's do it for you. We want to be flexible, but it can't be all over the place, right? Just for processing.
Okay.
So yeah, so very, very good question. Most people have been happy with Optum so far. Let me talk a little bit about why we structured a group policy. For those of you on the call that are familiar with Lasso Healthcare, if you guys remember Lasso, so Lasso was an individual MSA, and they grew to 35 states. The founder of that company, Jim Handlin, and I became good friends. And after he had left and all the stuff, I'm not going to get into why Zing bought him, why they pulled out of the market, whatever. The bottom line was I stayed in contact with Jim and said, Jim, you should start another company and you should offer a group MSA product, because the marketing rules are different and we can go to have all these different opportunities. And so he said, how serious are you? I said, I'm very serious. Just to let you know, I am part owner of Fenyx. I'm also their chief sales officer, as mentioned, but I did help raise money and am invested in Fenyx. One of the main reasons we wanted to offer a group product is because we get the federal waiver. So we're licensed in the state of Texas, only one state, but we're approved for sale in all 50 states. And because we're a non-network product, we're actually approved in every county. So literally our network, our geographic availability on a group chassis is all 50 states, every county plus DC. So that was fun and exciting. The other fun thing about a group product is you don't have the same marketing requirements. When you get attached to a group, and we'll talk about how a group has to sponsor our plan, that is one thing that's different. you actually have access to all of their active and retirees or anyone who's ever worked for them that you get to proactively outreach, right? This is different than just normal Medicare where you're limited on how you communicate to people. So we have some flexibility on getting in front of the groups. I do want to talk about.
Hey, Drew,
Yep.
just 1 second, if you don't mind. Cynthia has a question. Are you able to see it?
Oh, you know what? I can see when you raise your hand, but just, yeah,
Oh.
let me see if I can open the chat here. Okay. Okay. Client still working, has HSA now, turned 65, employer offers, can they keep the same bank as the current HSA? So that depends on who we have, like already as a custodian, because it's just too much to do one-offs, right? Because we've got to get the custodian to agree to our terms. Now, you bring up another point, Cynthia. When you're Medicare eligible and you enroll in any part of Medicare, you're no longer allowed to contribute to your HSA, right? So that's why this HSA could now be a good option to say, hey, you can't contribute to your HSA anymore. Now there's an MSA option.
But you define the term custodian, Drew.
Yeah, so the custodian would be our banking partner. So a Health Equity, for example, or a Zions Bank, or a Mountain America, or a US Bank, like literally any banking system that wants to participate in an MSA, print the debit cards, send out the disclosures for us. I mean, we're not really limited. We can do really small bank systems, regional carriers clear up to the Optums, the Health Equities if we wanted to. So no, and that's the other thing about an HSA and an MSA, right? You can't commingle the funds, right? They are separate accounts. You are allowed to move your MSA dollars one time a year to HSAs if you really wanted to. That's kind of a technical deal, but most people, they just keep them separate, right? So sorry, did you have another question there? Yeah, safest answer is probably not. Yeah, unless they're a custodian that we already have a contract with, then we could just say that's the custodian we want for that bank, for that MSA. Yeah. The way Medicare coordinates benefits, this is again on a group chassis, right? Of course, if it's just you and you're on Medicare, it's primary. We've got a new sole proprietor plan that we'll talk about today. If you have less than 20 employees, 2 to 19, then Medicare is considered primary. Your group is secondary. I think Nancy, you just answered a question. Yeah, no pre-authorizations or referrals. The only caveat there is if Medicare requires it, right? There are a few things that original Medicare requires. That's all we would require. There's no additional prior auths or referrals from Fenyx. So think of it just like original Medicare. So small group, the rules are different. Medicare's primary, group is secondary. We'll talk about a strategy we have. Large group, if you have 20 or more, Medicare is secondary, the group is primary, and you have the Medicare secondary payer rules. In the large group setting, the Medicare secondary payer rules are pretty clear, right? You have to offer the same coverage to your older population, 65 and older, their spouses, as you do the younger population. And the employer cannot offer a financial or other benefits as incentive to entice the worker, right? You can't entice someone, if you have more than 20 employees, to leave the group for Medicare, right? I can't say, Doug, love you, brother, but it's $1,400 a month to have you on our group plan. If you would just shift over to Medicare, we'll help pay for your Part B, rah, rah, rah. If you're a large employer, that's a no-no. If, however, you are considered a small employer according to Medicare, which is less than 20, those rules don't apply. So not only are you allowed to entice and incentivize and help pay for someone's Medicare if they're actively working for you, not only that, you can actually force them off the group. Even some of the group brokers don't quite understand this. You are not required to offer benefits to someone who is Medicare eligible on your group. You could kick them off. And people that say, well, what about discrimination, right? You can't discriminate Well, actually, the Age and Discrimination Employment Act doesn't apply to groups under 20, right? Medicare is primary. If you have 2 to 19 employees, Medicare is primary. That person really should be enrolling in Medicare A and B, and in most cases, almost all cases, it's going to be better to just go on to Medicare. So this is where we can work with group brokers, especially in the small market, where we can say, hey, let's move those people off the group, and we're going to show you our strategy to do that, which is super fun. So the power of the group, right? I use this in other benefits. If you have a group, and again, an employer, doesn't matter what size, you can be a group of 1, 10, 10,000, 100,000, doesn't matter. Any group can offer our 3 standard plans at 0 cost to the group, right? There's no premium to the member. Of course, we're available in all 50 states. You know, what's good for the potential member, 0 premium plan. Of course, you're still paying all your other Medicare premiums, Part B, etc. But we don't have referrals. We don't have authorizations. We have a unique financial support plan I'll talk about. Agents, you get paid. Group chassis is a little different. You get paid per member per month, whether they're new to Medicare or not. And we have an agency contract with Stonehill. And as you go through the contracting process, they'll let you know how the commissions work in your setting. Again, for agents, this flexibility to reach out to the group, right? To reach back to people that worked for the group and get introduced to them, basically getting those leads. The other thing on a group chassis is we don't require your AHIP certification. You know, CMS, when we apply for a license, on a group chassis, they allow you to either have AHIP or product certification. So we went with product certification. So that's what you would need to do to get appointed to sell with it. Any other questions so far? This is our network access. It's pretty good. I do believe, if I remember correctly, we are the only Medicare Advantage plan in the entire state of Alaska right now. So if you have businesses up there, we'd love to go up there for work. Greg, did you raise a hand? Did someone raise a hand?
I did, Gene.
Or Gene, sorry, thank you. I see it pop up and then it goes.
That's all right. So the question I had relates to what you were just talking about. Let's say that I'm working with somebody that has a company and they have employees out of state. I'm licensed in the state of Utah, but they happen to have employees up in Idaho as well. Do I need to get a state license in Idaho to be able to cover those additional employees? How does that work?
Great question, Gene. So because we're on a group chassis, we have one license, right? Fenyx Health in the state of Texas. So literally, if you go to the Department of Insurance in any other state, you won't find us. So you're not required. You know, for us, we have the one license. What we decided as a company, what we think is good business practice, is you are required for us to be licensed in the state that the company is headquartered. So if your company is headquartered in Utah, regardless of where their employees or their retirees live, you can reach out to them and sell our product. Because we don't fall under the same marketing rules, there's no scope of appointment that you sign with our product, right? You get to reach out to them. Now, clearly, you guys can probably already see that this is a great way to get in front of qualified leads, right? So the ability to get in front of people does not mean that our product's the right fit. So as someone says, well, that may not be a right fit, what else can we do? Then that's, of course, where you would want to follow your the guidelines and help them with other products. There was one other question I think popped up here. Oh yeah, outline of coverage. Yep, that's literally just coming up right next. So give you an example of some groups that we work with. Literally, like I said, any size business, right? Doesn't matter. And sole proprietors, we got the product coming out. PEOs are a great fit. What's unique about like PEOs or associations that are employer related or chambers, when they sponsor our product, then everyone within their umbrella gets access to our product. So for example, you know, the Association of Idaho Cities, We met with them, you know, basically every city in the state of Idaho is a member of that association. And we presented to the Association of Idaho Cities, said, hey, if you'll offer this benefit, every city that's a member of your organization could benefit from this. And then agents can outreach, and they loved the idea. So they decided to offer it. So instead of going to each individual city and saying, hey, you should sign up to offer this product, we were able to go to the association and we kind of get that blanket, right? And now any agent that's certified with Fenyx, if you know someone that retired from a city in Idaho, this is now a new option for them. It's kind of cool. We've already done that with the Association of Counties in Utah. So every county in Utah has access to this. Almost every school district, I think we've got 1 or 2 left that have not signed up for it yet. And the University of Utah signed up, the school. So we're starting to get some bigger names coming, which is really fun. But unions would work, local state governments, all that stuff.
So where some of those are already open, the school districts, the counties, different things like this, can just any agent go work with some of those retirees, or do you have to have, I mean, whoever opened it up? I mean, what's the connection or the availability of just working with those employees?
Yeah, great question, Craig. So the agent that signed up the group, the benefit that they have of being the agent of record, so to speak, is they have access to the data, right? So they can actually have the group, right, give them data for the outreach. That does not stop anyone else from offering the benefit to people they know who have retired from that group, right? So if you know someone that retired from you know, Provo School District, you can now say, hey, there's a new option available to you, right? The value to getting the group signed up is you can get that data and proactively outreach, right?
Okay.
But no one else is excluded, right? You could imagine if we structured it that way, everyone would be jumping, you know, racing to get people signed up. It's like, no. The value of you being the agent of record is getting access to the data, but literally anyone. Same with the Association of Idaho Cities, right? There's no real city that signed up individually. It's just now it's available. Now you get to go out and meet with the cities or meet with the retirees, which is kind of fun. The chambers will work very similar to that too, right? If a chamber signs up, same thing. All the employers related to that chamber, you know, you still have to go and meet with them. So kind of fun.
Does that impact commissions or overrides in any way?
Nope. You get paid directly for the person you sign up. Yep, absolutely. Another question was, with the group, do you need a scope of appointment or permission to contact before contacting a retiree in the association? No, on a group chassis. So again, if you don't know the individual, kind of hard for you to reach out to them. That's the advantage of being the group agent that signed the group up, is asking for the data. But yeah, literally, if you have a colleague or you have a client that retired from Provo School District and you know that Provo's already a group signed up, and you can see the whole list of people that have groups that have signed up when you go into our application, then you can just say, hey, this new benefit's offered to you. So kind of fun. These are our 3. Yep, go ahead.
So there's a question being asked here, and it says, with its being a group, do you need a scope of appointment or permission to contact before contacting a retiree in the association?
So no, you don't need a scope of appointment with our product because it's on a group chassis. Now, how do you contact the retiree, right? If you're the group broker that signed up the employer group, the advantage is you get to ask the group to provide the list, right? If you're not the agent, then you just have access to the people you know retired from that group. Does that make sense? So for example, the agent that signed up the Provo School District, they could go to the Provo School District and say, hey, would you run a list for me to outreach to these people? And they can proactively outreach, whether they're your client or not, right? They get that right on the group chassis. You have a retiree from Provo School District, you can now just go to them because you already know them and say, hey, this new option's available to you.
Is there
Right.
a list of groups available so we know who's already been enrolled?
Yeah, we'll get you the most recent updated list. When you're fully certified to sell, you'll have a link to an application. So when you're actually ready to enroll someone, and it literally has a drop down, and every time we have a company sign up, we add them to the drop down. So you can just scroll down and select which group they're part of. So, okay, with egg whips, we have permission from the groups to contact the retirees, so it's not a cold outreach. That's correct. So with the group, right, the outreach is if they're sending you the list, the group broker that is connected to the group gets to do the outreach. If they're already your client, of course, you can approach them and say, hey, there's this new product available. I know you retired from Provo School District. You know, we have something we want to share with you. Gives you that flexibility.
So let me ask a question. So let's say that you, your neighbor is a business owner, and you reach out and you talk to him, and he decides that he wants to enroll with you, and then you later find out that his business is part of the Chamber of Commerce that already had, that was already enrolled in this. Does that mean that you can't enroll and you can't work with his, and you won't be able to see his employees? Does my question make sense?
Yeah, it's actually the opposite of what I think you're saying, because the chamber, that is where that example is the perfect example. The chamber signing up, right? There's no one agent attached to every single employer group. It's available, but the chamber sponsoring it. So you, as the agent, Doug, now get to go to that business and say, hey, the chamber is sponsoring this plan. We would love to work with you. If you'll share data with us, and they agree to do that on a group chassis, then you can do the outreach. So that's where you as the agent would want to work with the business to do the outreach. Do they need to sign up themselves? Technically, no. If they've already signed up and then the chamber signed up, it's still fine. You're connected to the group. You get to do the outreach, right? And that's happened. We signed up a few cities, we signed up a few counties, and then we go to the association and they're like, yeah, let's offer this on a whole. It just saves us that step of meeting with the individual entity to sign the form. We can now just go and say, hey, this is being offered. We'd love to work with you on marketing and outreach.
Okay.
So gives you some flexibility there. I think there was one more question here. If I remember, let's see, with it being a group product, can the company association customize plans from the standard options? So these are our 3 standard plans. We do offer customized plans. That's usually in a case for like retirees where they can pay for plans, especially in your egg whip market. But usually it's our standard plans, or all 3 options are available, right? But visit with us. Let's look at the group. We are able to customize plans. So let's just go through the mechanics of this plan. We have our MSA 50, 100, and 200. All 0 premium to the beneficiary by law. We have deductibles. We have deposits. You know, the MSA 200, for example, 2,400 divided by 12, right? Our product is prorated. So if you sign up for a January 1st effective date, it's a $6,000 deductible. It's a $2,400 deposit. Every month after that, if you enrolled, it would be adjusted, right? It's prorated. So if you signed up in July, it would be a $1,200 deposit, right? Your deductible would be $4,800, because we're always going to keep this effective max out of pocket. And we have a chart that breaks down every single month, so you don't have to try to think about it. But pretty simple, one of the easiest plans in Medicare to understand. How does it work? You pay 100% of all Medicare A and B expenses until you hit the deductible. And then after that, Fenyx Health pays 100%. And we'll talk a little more about how our financial support program works. We gave you $2,400 from Medicare, from the government, to help offset that $6,000. If you spend that all on those costs, then you're only out of pocket $3,600, right? If you look at our MSA 50, $2,800 deductible, you're only getting $600 deposit, but you're only at risk $2,200. That's $183 a month. A lot of people paying more than that right now for a supplement, right? Or if you look at a high deductible plan G, What is that right now? $2,800 deductible with $45 premium. This just gives you another option to think outside of what is currently available. What's really cool is, guess what happens if you don't spend the $2,400? Think HSA, right? It rolls over. You keep it. You never lose it. Or you can spend it on any other qualified medical expense without the tax consequences. So it comes in pre-tax from the federal government. It grows tax-free. If you have more than $2,000 in your MSA account, you can invest it, similar to an HSA, right? And as long as you spend it on qualified medical expenses, you don't have to pay taxes on it. Eventually, we will all leave the earth, right? There's 100% chance we will all leave the earth, right? I love back in my Northwestern Mutual days, you know, people would talk about life insurance and, oh, I'm gambling. And I'm like, no, you're not gambling. There's 100% chance we're all going to die, right? It's you're measuring risk. Eventually, we're all going to leave the earth. Whatever you have left in your MSA stays, it goes to your beneficiaries, just like your HSA or your other tax. It's a tax favored account from the government. So those are our standard plans, okay? We then have a strategy for small groups. Now, this is where I'm going to try to switch screens because I think it'll be easier. Excuse me. If I switch to the actual spreadsheet. Can you guys see those numbers okay on that screen?
When I put my glasses on, I can.
All right, hold on here. Are Medicare covered preventative services something that come out of your deposit? Great question. So yes, that is one thing about the MSA is everything goes towards that deductible, even preventative care. So it's not covered before the deductible because Medicare is giving you the deposit. That's probably the number one question on our product certification that gets missed because everybody thinks, nope, Medicare is going to cover preventative. MSAs do not, right? They're giving you the money. Now we do have some contracts with some direct primary care in some states right now where if you go to them, they provide the preventative services at no cost. We actually pay them a capitated rate to do that. And so we will work with health systems in the area and try to work that out with them because that is kind of a fun thing to do. But great question.
Hey, Drew.
Yep.
How does CMS handle star ratings in group products like this? Are there star ratings or no star ratings, or how does that work?
Yeah, no. So there are star ratings. So we have a new plan star rating. That's pretty normal. And then we'll follow those. We'll follow the metrics, you know, as we get beyond years, you know, 2, 3, 4, 5. The way that we're paid, right? You know, we are paid similar to other companies. Think Select Health, United, Aetna, whomever, right? On average, insurance companies get paid about $1,000 a month per Medicare beneficiary, right? So in our case, let's use the $1,000 example. Okay, that's $12,000 a year. Medicare, if you sign up for the MSA 200, they actually front us the $2,400 the first week of January. We put it into your bank account. Okay, that leaves us $9,600. They divide that by 12. Medicare sends us $800 a month, right? That's the money we have to pay commissions, to pay, you know, claims. Of course, we have reserves. We had to have reserves before we could even get our insurance license. And, you know, admin expenses. And then we follow the risk score, right? So if you're a really unhealthy person, for example, if you have end-stage renal disease and you're on dialysis, you know, we may get $7,000 a month, right? Probably still not going to make money there, but so we are paid on a similar schedule, but we don't do the bids. We actually get the full benchmark. That's one unique thing about the MSA. So it's very actuarially favorable. Most people looking at our plan, they see a high deductible. Think people that are coming off of HSAs, right? They may be a healthier person. They self-direct their care more. MSAs are just very actuarially favorable. So So yep, the star ratings will be subject to that too. And that is also why we want to work with health systems, right? To do the preventative care, because, you know, people are like, well, I don't want to go spend my deposit on my preventative care, right? Well, no, we want you to do that. So since it's offered by employer, can and will the employer pay the Part B premium? That's this, you tied this up perfectly. So this spreadsheet right here is specifically for groups that have 2 to 19 people, so less than 20 employees. Like we talked about earlier, if you have less than 20 employees, Medicare is considered primary. And so we can actually decide, right, whether or not you want to kick people off the group. If you have more than 20 employees, for an active employee, you're not allowed to entice them to leave the group, right? Paying for their Part B would be considered an enticement. So can you do that? No. For a large group. Can you do it for a small group? We're going to show you that right now. Can you do it for retirees? Absolutely, right? So you can make some changes there. This is an actual group, just to let you know. This is a group with Regents, Blue Shield, and Idaho. They currently have a $3,250 deductible. Their max out of pocket is $8,000. That's the medical and the pharmacy benefit, right? Hold on here. There's another question here. Yeah, do the bait and switch rules apply when you outreach? In other words, if you reach out to a retiree and determine the plan is not the right fit, are you prohibited from talking to them about another plan? So no, right? You're getting in front of them because of the group. If it's not the right fit, then you would follow the same rules with talking to them about other plans, right? You do get to, that's actually one of our benefits, is you get to get in front of people, right? And if it's not the right fit, you shouldn't be selling it to them, right? I think I told Doug and Nancy several times, good agents, which you guys are, you're going to do what's right for the individual, right? You are going to help them with what's best for them, right? So you got to meet with them, and then you have to have enough available products. So yeah, the scope of appointment, you'd want to follow all your other rules for other Medicare plans, right? Our group plan doesn't apply talking about our product, because you don't even need your AHIP to sell our product, right? So if all you wanted to do was sell this and talk about it, you know, you don't have to have your AHIP, you don't have to have a scope of appointment. But follow all your other rules with what you're doing there. So this is our small group strategy, which I think is pretty unique and cool. A great way to get in front of groups. I'm going to kind of talk as if I were talking to the employer here to walk through it. And you guys, if I switch you guys can still see the spreadsheet, right?
Yes.
Okay. All right. Because I have to switch my screen so I can actually type here. But so Mr. or Mrs. Employer, you currently offer a plan that has a $3,250 deductible, medical deductible. Your max out of pocket is $8,000. That's medical and pharmacy. Currently, right now, for someone who is 64 years or older, it's $1,200 a month premium. And you have a gentleman, we're going to call him Johnny, who's on that plan. Right now, you pay 80% of his cost. He pays 20% of the cost. So Mr. or Mrs. Employer, that's costing you $960 a month. Johnny's paying $240 a month. And these are the annual amounts that you're currently paying. What we're recommending, Mr. or Mrs. Employer, because you have less than 20 employees, is we move Johnny to the Fenyx Health Small Group MSA option, where Johnny's going to have a $6,000 deductible. Over the course of 12 months, we're going to deposit $4,800 into Johnny's MSA account. So if Johnny uses all $4,800 that we give him over the 12 months to go towards his $6,000 deductible, his new effective max out of pocket is only $1,200. Now that's just for medical. Johnny's also going to have to sign up for prescription drugs with Medicare. But what's great is the new max out of pocket for prescription drug plans is only $2,000. So worst case scenario, if Johnny maxes out his medical and his pharmacy on this new Medicare plan, that's only $3,200, much better than the $8,000 he's on right now. Now, what's that going to cost you, Mr. or Mrs. Employer? It's going to cost you $650 a month. What we're going to do is we're going to set up an HRA, a health reimbursement arrangement, we're going to contribute $250 a month into that HRA. We're going to do that for you. You just give the $650 to Fenyx. The reason we're putting $250 into an HRA is because Johnny needs to enroll in Medicare Part B. And for most people, that's $185. We're also going to allocate $65 a month for prescription drug plan. We're not allowed to pay Part B or Part D premiums with MSA funds. So that's why we need the HRA to do that. We're also going to use the other $400 to help fund the MSA and other admin costs. Now, there is a one-time $100 setup fee. NBS is our partner out of Salt Lake that helps us with the HRAs. And then there's a $4 a month per person per HRA, or a minimum of 15. You'll just pay us the monthly fee, and we take care of everything else. So you went from $960 a month, Mr. and Mrs. Employer, to $650. So that's $3,720 a year in savings, just in premium. What does it look like for Johnny? Johnny went from $240 a month to $0. So he just saved $2,880. Plus, he now has the opportunity to earn $4,800, because if he doesn't spend that MSA money, if he doesn't need to, he gets to keep it. So Johnny could be almost $7,700 better off. The other cool thing for you, Mr. and Mrs. Employer, you know, your annual cost is now $7,800. That's the $650 times 12. But what we've also found is when we take the Medicare eligible person off your small group, on average, you save 5% in group renewal premium. So right now, Mr. and Mrs. Employer, you're paying $125,000 for the other 15 people on your group. When we take Johnny off, if you can save 5%, that's another $6,000 in premium. So you're going to save $3,720 just by moving him off your plan, with the potential to save another $6,250. That's almost $10,000 a year. Mr. and Mrs. Employer, every month we delay this strategy, it's costing you $830 a month. Now, we typically have a 3-month lead, a 90-day lead time, because we got to get Johnny signed up on Part B if he's not already, and set stuff up. But our team will help you do all of that. And what's great is the group broker, your current group broker for the health insurance, they can actually get paid. Right? So Fenyx Health will actually pay the group broker as we move Johnny off. He's going to lose money because we're taking him off the group. We'll actually pay the group broker, and the Medicare brokers will get paid as well. And actually they'll get paid even more money, which is kind of fun. All right. We've got another question here.
Yeah.
We've got a number in the chat box too. So
Good.
So
Okay.
the question that I had was, when you're coming off a group plan, we know that gives us a special election period.
Correct.
So that's not a problem. We can do that any time of the year. The other question that I had is, suppose that Johnny had previously elected to go to a Medicare plan, whether that's an Advantage or a supplement, whichever, and this came along and he said, gosh, I hear Joe over there is getting on this plan. I want to jump on this plan. Does he have an opportunity to do that?
Thank you, Gene. So the other reason that we wanted a group Medicare product is you can enroll any month of the year. We don't follow annual enrollment periods. So once a group sponsors our plan, then any month of the year someone could enroll in our plan. Now, in your specific, there is a question here with, I think Craig asked, for small employer, can someone already on an MAPD switch to this throughout the year, or do they need to wait? On any size employer, right? On a small employer, if you're already on Medicare and your employer's not for it, then this situation would just be our standard plans. But the answer is yes. If you're on an MAPD and you switch to our product, then when CMS gets the notice to disenroll you from the MAPD because the new Part C is taking over and we're MA only, then that gives you the special enrollment period to sign up for a separate prescription drug plan. Let me just read this one. Does that make sense?
Well, just to be clear, Craig was asking if you have to wait for the annual enrollment period. You're saying, no, you don't have to wait for any enrollment periods. This gives you a special enrollment.
Yeah, as long as the employer has offered it, then you can enroll any month of the year. Correct. Yep. Let me say, so Cynthia, I believe you answered this. To clarify, if I am contracted to offer this product and a person who is part of a group that has Fenyx, can I offer this product to another if it's a better fit? Do I have that correct? I do not have to be the broker who set the group up. Correct. You do not have to be the group that enrolled the group. You just have to be certified to sell our product, and any client that you have, if their group has already sponsored our product, this would be available to them. You are correct. The benefit of being the broker, the Medicare person that got the group to sign up, right, is you get to ask them for data, right, to do the outreach. But yeah, you get to offer it, which is fun. And you'll see that a lot with like the chambers and the associations. You know, I mean, quite honestly, I'm actually typically the one that actually signs up the chamber, right? Because it's not a specific broker that's attached to any employer. It's like, hey, now let's go out and market. And if you have relationships, work those relationships. It's just fun. Yep. So flexibility on any time of the year enrolling. Now we do follow this, our product, because it's voluntary, right? In our standard plans, we do follow the Medicare trial right or trial period rules. So if this is the first time you've ever been on Medicare Advantage, you have that 12-month window to go back to a supplement with no questions, right? If you've previously been on Medicare Advantage or you go past the 12 months, then to move to a supplement, you would have to do underwriting. So, and some people are like, well, if I move from my supplement and I don't like this for some reason, gosh, you know, I'd really want to go back. You know, and if I can't do that after 12 months, you know, well, that's where our MSA 50 plan, you know, most people are paying more, especially as they get a little older, paying more than $183 a month. It's like, just move to the MSA 50 if you're nervous. You have the, you know, same network, prescription drugs are separate. You know, I had a gentleman in Ely, Nevada. It's actually where I was born. And he was paying $370 a month for his plan F, right? And his wife's like, if we sign up for the MSA 200, effectively our max out of pocket's $3,600. We're paying more than that in just premium. So even if you max out your deductible, you were still better off, right? So just giving people more options. But does this make sense on the employer side, where you can really, I mean, I'll answer the question here in just a minute. I've got a client in Elko, Nevada. It's $1,800 a month for someone who's over 65. They pay 100% because they're competing with Nevada Gold. Just by moving that person off the group, the savings is almost $14,000 for that group, even if they didn't save anything on the group renewal. So you'll all have access to the spreadsheet, by the way. I can send this. This is just an interactive tool. It's, you know, actually EMI Health has white labeled us in the state of Utah. So if you sell our product in Utah, it'll actually have EMI Health. It doesn't even say Fenyx Health. So just a fun way to get in front of small employers that have someone who's actively working that's Medicare eligible, as a way to say, you guys could save a lot of money. I just had a meeting this morning with a national carrier that we got referred to specifically about this. And they're looking at it as, oh my gosh, we can go to all of our groups that have less than 20 employees. And if we pull those Medicare eligible people off, that really changes the rates for us. Like, this is good for the employer. It's good for the broker. The Medicare agent gets paid. Like, everyone wins, right? And so getting attached to some of these carriers will help with that. I trust you'll provide information on how agents are compensated. What is the commission rate per enrollee? So yeah. So it's on a group chassis. It's per member per month. Like I said, it's as earned, and that'll come through Stonehill as you do the contracting. You know what your commission schedule would be. So
you may have touched on this earlier, but did you say that this is or is not network driven, or is this like a private fee-for-service plan where you can go anywhere as long as they accept it?
Yeah, so it is a non-contract plan. MSAs are designed that way by CMS, right? It's not something Fenyx came up with. And so the intent is, and literally, if you look up MSAs right on Medicare.gov, right, CMS, it states you have access to any Medicare provider in the entire country. They do have to be willing to bill us, right? Because we are managing Medicare. It's not original Medicare, although it functions just like it. Let me share this with you. Any other questions on the small group strategy, this calculator? Let me stop sharing that. I almost clicked end the call, so I'm glad I didn't do that. Okay, let me go back here to our standard plans, but yeah, questions like that. I want this to be as interactive for you. Wait a second. It didn't let me share my screen. Hold on here. Why is it not letting me now share?
There it goes.
Okay. Question. Was there a question, or did I was hitting too many slides?
I think you answered it.
Okay, perfect. Yeah. So here's one thing. So think back to Lasso, right? One of the challenges of Lasso is you walk in the door, you have this high deductible plan, which is not normal on Medicare, right? And the provider's like, one, I don't know who Lasso is, or I don't know who the carrier is. And I got to collect this high deductible from you. Like, why am I doing this, right? Of course, it's always amazed me because the month before you were eligible for Medicare, you most likely had a bronze plan that had a $9,000 deductible and they had no problem seeing you. I'm like, okay, so one of the things that Jim and I decided to do, right? I helped design all these plans, was one of the pain points was this high deductible. So we actually, Fenyx Health, we actually offer what's called financial support, where it doesn't matter which plan you choose. Okay. It doesn't matter if it's the MSA 50, 100, 200. It doesn't matter if you're on our small group strategy, if you're on our sole proprietor strategy, we'll talk to you about. Fenyx Health, we actually front the money. We pay the entire deductible to the doctor or the hospital, and then we turn around and collect the money from you. So literally the provider, the hospital, the doctor, they don't even send you a bill. So it's effectively 100% below the deductible and 100% above the deductible. Fenyx Health is paying. We come back to you and we say, Doug, you went to the hospital. It was $2,500. That was the Medicare allowed amount. Milliman repriced it. Milliman is our actuary and our Medicare repricer. We paid that for you. Doug, would you like to pay us back with money in your MSA, or how would you like to pay us back? And then we give you several months to do that. We give you flexibility. So we're taking some financial risk there clearly, but typically the people that are signing up, they come from HSAs, they have HSA money, or they were going to pay it anyways, right? So this has been really big for us with acceptance with providers, them understanding how they get paid, right?
That's
so when a provider so literally I just had this call yesterday with St. Luke's. It's like, we've never heard of Fenyx Health. I said, well, let me ask you a question. Do you accept original Medicare? Absolutely we do. Well, you're going to love our product because we actually pay you 100% of Medicare, not 80. We literally, when it's repriced, we will pay you 100% of Medicare. That's allowed for our member. You don't even have to send them a bill. And the ones that have gotten it, they're just like, we love it. The small hospital in Elko, Nevada, which is privately, it's a publicly owned, right? I thought, this would be a little bit of a challenge. We got a hold of the billing department, explained to Stacy how they get paid. She loves it. She's like, I've never seen anything like this. We don't even bill the patient, which saves them money, by the way, too. So that is something unique. We do it across the board, all 50 states, all of our plans. We pay you 100%. And we have a really nice 2-page provider piece that every member gets. If you tell us, hey, I'm going to go to this doctor, we'll call them for you, right? We'll say, hey, our member is going to be coming to you. Of course, if it's an emergency, but we've had great success at University of Utah. St. Luke's has, billed us. The one hospital we've had a challenge with is William B. Ryrie in Ely. They were just we don't care. If it says Medicare Advantage, we're not accepting it. We've actually been talking to CMS and they're like, no, we want to know why they're not accepting it, because it is meant for it to be access to any provider. Renown in Reno, they're 50. I mean, they, no pun intended, right? They are renowned for not accepting Medicare Advantage except for their own product. They've been 50-50, right? Half the time they submit claims, the other half they don't. We're working with relationships to say, hey, let us help you understand how you're getting paid. If you accept original Medicare, you're going to love our product because we pay you the 100%. And so it's pretty unique. So and those of you that have experience with Lasso will really appreciate that.
So speaking of Ely, so we do roofing and I'm out there quite a bit, know a lot of people. I actually have friends that work at the hospital there, so I know what you're talking about.
Yep.
Rural area. And they actually all have like a policy for the med plane, to come in and out. So in that area, there's no Medicare Advantage plans available. And I think they had Lasso.
They did.
They did. So what did they do in that situation? Did they not accept the Lasso at all? Do you know? Or
no, they did. I know Matt really well, CEO of William B. Ryrie. And so no, they were having challenges with Lasso the last few years. They didn't feel that Lasso was paying them what they were supposed to. And I know there's a few other questions I'll get to you guys. And so when Fenyx came out, of course, I was excited to explain to him that, this pays differently. You're not going to go collect the deductible. But the current CFO at the time, and I'm not sure he's still there, but was extremely negative, and even towards me, like blaming me for Lasso not paying them. And I'm like, dude, and then, well, Jim was the CEO. No, he wasn't. After he left is when they seemed to have problems, right? And if they weren't paying you what they were supposed to, we are required by CMS, that is our contract, to pay you just as Medicare would pay you. If you're a critical access hospital, which William B. Ryrie is, if you share your all-inclusive rate schedule with us, because Milliman doesn't have access to that all the time, then we will reimburse you the critical access rates. That's where these hospitals hate Medicare Advantage, especially critical access, is they're not getting the extra money for their ruralness, right? And so Medicare has what they call all-inclusive rates and different schedules, depending on where you're at in the country. So if you'll share that with us, we give that to Milliman. Any claim that comes through, it gets repriced. You get paid the full amount. Critical access hospitals should be our #1 champion. This, they hear Medicare Advantage and they think you cussed at them. It's like, look, I get it, but ours is different. Think original Medicare, which you accept. You're going to get paid 100%, not 80%. You're going to get paid 100% of the allowed amount. And so we're still trying to work through that. They were still like, we don't care. It's, okay. Well, the people we have signed up there know that they can go there for emergencies. Yeah. And if something major, they usually go to University of Utah anyways, right? But I think we'll work through some of those challenges. And as more and more people say, is there a reason you're getting paid? You're like, there's no harm coming to the doctor or the hospital, because Fenyx is literally funding the deductible now, right? With Lasso, they weren't. I can see where a hospital's like, I don't want to collect the money. I don't have to take it. Yeah. We do things a little differently. So, and we're working close with CMS to try to get some other, say, hey, let's work. There's no injury to the hospitals. Like, they accept original Medicare. This is awesome. Let's work through some of that. So the answer, 2 questions. Can you move from an MSA 50, 100 to 200? Yes, from year to year, not every month. Enrollment is any month, but changes are during your annual election period. So if you're on the MSA 200, you feel like, oh, I'm going to have a surgery, I don't want to take that much risk, you can move to the MSA 50 the next year, correct? And does the Mayo Clinic take it? The answer is you have access to the Mayo Clinic, right? We didn't have problems there with Lasso, so to speak, except for sometimes there's that initial, we don't recognize it. It literally is jumping on the phone call, helping them understand it. But yes, you have access to the Mayo Clinic. So pretty cool. Mm-hmm. And I tell people, so 2 ways to explain it. One, probably the best way to explain it is, do you take original Medicare? And because if they do, right, they have to accept you if they're accepting new patients. In our case, you're not forced to, but it's how you get paid, right? If I went to if I went to a hospital or a doctor's office, the hospital specifically, and it wasn't an emergency, and I needed a surgery done, and I didn't have insurance at all, the conversation would be, well, Drew, how are you going to pay us? And I'd say, well, what if I gave you this much money and then I made these payments, and you would agree on a payment schedule, and they'd say, okay, let's schedule the surgery, right? Doctors and hospitals, they need to know how they're getting paid. And so as we develop those relationships, it'll get easier. One of the reasons we want to white label with regional carriers like EMI, for example, we have others that we are in negotiation with. We can't say who they are yet, but when we have the contracts, we will. The other reason we're doing that is because then brand recognition, right? The doctor's offices, they just see that it's the carrier, and they're like, oh yeah, we accept that. They don't even know behind the scenes it's really Fenyx Health, and we're paying them 100%. But we'll work through those things. It's like anything. There's bumps in the road. You get that right now with your Medicare Advantage, right? Even if the hospital takes it, you have to deal with prior auths and referrals. With us, you don't have to do that. So that's a big thing for the hospital systems when they know, okay, we're not trying to get extra prior auths or referrals.
Drew, did you get to the question on the Sherry's question on commissions?
Oh yeah, I thought I did. Yeah.
Yes,
So
yes, he did.
yeah. So the agency contract is with Stonehill. So as you do your contracting portion, then they'll let you know where that commission schedule is for you.
And
I
so
want-
we do,
Oh, go ahead, Doug.
I was going to say, so we do want to talk with you because some of you have downline agents and some of you are street level agents. So we do want to talk with you if, about compensation. So.
Yeah. So just going back to our small group, let me talk marketing a little bit. Sometimes when an individual Medicare agent learns about this product, sometimes it's a little harder for them to, I don't have experience with group. Where's this a fit? And so I usually ask the question, who do you know who's either been an employer or an employee? Everyone. That's the answer every time. Well, everyone. That's right. So if you meet with Mr. or Mrs. Employer, hey, you have probably never considered offering a Medicare retiree benefit for 3 reasons. 1, the cost to do it. 2, the potential liability. And 3, the work it would take to set up the group. We now have a solution for you. We have a product that doesn't cost you anything for our standard plans. Because there's no cost to the employer, there's no liability, which means we are not actually subject to ERISA, and you don't even have to report this on a 5500 form. It's a voluntary product. It takes 5 minutes to fill out our online form for the group to sign up and sponsor it. Doesn't matter how big the group is. And then anyone who's ever worked for you would now have access to the product, and then we'll work with you to outreach. I mean, think of all the employer groups that don't offer retiree benefits. It's 99%, 95% of the entire country, right? Even your largest employers, they can now say that they offer a Medicare retiree benefit. If you have less than 20 employees and you have a Medicare active person, we've got a strategy to reduce your health premium costs, but it's still available to anyone who's ever retired, and you get referred to them. And so you get the opportunity to get in front of people. If you meet with Mr. or Mrs. Employee, well, who did you work for? Oh, I used to work for the Provo School District. Oh, wonderful. You may not be aware that there's a new benefit available to you. Or if the Provo School District hadn't signed up, do you have a relationship there? We'd love to get in front of them, and they could offer a new product to you. How cool is that?
You said something there. So that triggered a question in my mind. So let's say that they retired from the Provo School District, and the Provo School District hasn't signed up for the MSA, but they had previously worked for the Timpanogos School District, and they had. So even though they retired from Provo, they had previously worked for Timpanogos, so they could sign up underneath Timpanogos. Is that what you were intending?
That is correct. It doesn't matter if you worked for someone. It's not based on did you actually retire. It's did you work for them. And because we're a voluntary product, Doug, it's actually also extended to 1099. So
Okay.
think of all your multi-level marketing companies, right? Take what's one down there? New Skin, are they multi-level marketing?
Yep.
So take New Skin, for example, large employer themselves. I'm sure they have how many employees do you think they have? 3,000? I don't know.
Yeah.
I'm literally just throwing a number out there. So they're a large employer. So they could literally say, we're now going to offer a Medicare retiree to all of our retirees. But guess what? All of their 1099, which is their whole distribution. I mean, how cool is that? We have a company up here in Idaho and we're trying to work with them. They haven't agreed to do it yet, in a similar situation. Thousands of employees, thousands and thousands of retirees over the last 30 years, all of their distribution. And when I met with the CFO, I said, here's an idea. What if we write a letter? You guys approve it. The CEO approves it. It's privately held. Wouldn't it be cool if we sent out a letter to the people who used to work for you and your distribution, and it says something like this: Doug, thank you so much for all your years of service helping such and such company become what it is today. We're excited to announce that we're now offering you a Medicare retiree benefit at no cost. Please call Stonehill and their distribution to help find out. That's just a win. That is just a win.
Yeah.
And oh, by the way, when you're hiring and when you're recruiting people, here's all your benefits, Doug, Colette, here's everything we're offering you. And oh, by the way, when you retire, when you're eligible for Medicare, you'll have access to a Medicare retiree benefit at no cost to you. It's just so powerful. The opportunity to get in front of people. What are you trying to do every day? You're trying to get in front of qualified leads. So let me give you another example. And I will share the name with this one. Canyon County in Idaho. I believe it's the second largest county in Idaho. Okay. It's Nampa, Boise, it borders Oregon and Boise. Okay. So we have a group agent who has partnered with some Medicare people because he doesn't, he's a large group agent, doesn't do any Medicare. He was trying to take over the benefits. Okay, the county commissioner said, no, for whatever reason, we're just staying with the current broker. He had got introduced to us. He went back and said, hey, we've got this pretty unique product. You don't have to change anything you're currently doing. We're not changing your group broker. We're not changing your other benefits. We're literally adding this new Medicare product as a voluntary product. The HR gal, she's like, I love it. So they brought me over, we met. Why would we not do this? It costs us nothing. So they said, let's do it. So we signed them up. They had me come to their benefits fair. They have 900 employees. I asked the HR director, I said, would you be willing to run a list of people that are actively working for you that are soon to be Medicare eligible? We can't force them off the plan. So she went and ran the list. 115 people in the next 18 months out of the 900 are gonna be Medicare eligible. That Medicare agent now gets to get in front of those people, right? Now, if they stay working, they stay working, but you're getting in front of them, you're getting the lead. Then we asked the HR person, would you be willing to go back 3 to 5 years? And she agreed to go back 5 years because their computer system changed 5 years ago. And she'll run a list of anyone who had ever worked for them that was 60 years or older and share that with the Medicare agent, and they get to proactively outreach. One company, hundreds and hundreds of people that you now get to get in front of on a favorable basis. It's just so powerful. There's nothing else like it.
So Drew, I got a couple of questions here that I just received by email.
Oh, good.
So the first question is, if everyone can call people that are part of a group/association, it seems to open the floodgates to many agents/brokers reaching out to the same people, including your existing clients, without a scope of appointment or permission to contact. Are there any CMS guidelines that keep this from becoming a bloodbath other than the do not contact list question?
Yeah, so little caveats in there, right? You are not allowed to call people without the group's permission. If they're your current client and they work for the group, that's different. If you're the group agent that enrolled the group, then you would be able to outreach. In the case of a chamber, you have to get with the group, right? You have to get permission from the group to get the data to outreach to them. I don't know how you'd outreach them without the data anyways. But that's where the rules are in our favor, right? The rules are in our favor because the group is sharing the data with you. So a chamber is a blanket way to get access to people to enroll. I'll give you an example in Elko, Nevada. Okay. Nevada Gold, largest gold mine in the world. Okay. Got a lot of people. My dad still works for them, right? Went and met with their HR director. You know, you guys should offer this. We have lots of people that would like it. You know, the other Medicare agents in town would like access to it. You guys currently offer an HSA through Fidelity. Like, it's such a good fit, right? Well, the attorneys would not budge. They're like, we don't care. We don't want to sign any forms. Well, it's not available if the employer doesn't sponsor it. You can't go get this on the open market. That was the opportunity for us to say, okay, there's really no reason for you to say no, but you can still say no, right? I mean, literally, why there's no risk. It's not costing you anything. Why would you not say no? But if you're a large company and you want to say no, fine. So that was the opportunity for us to go to the chamber, and we were going to the chamber for other reasons, saying, hey, if you guys sponsor this, all of your groups could have access to this, right? Especially in rural Nevada. Well, guess who happens to be a member of the chamber? Nevada Gold, right? Which includes Barrick and Newmont because they merged. So then we could go back to those people and say, hey, you're now eligible for this new product, right? I had someone call the other day that worked at United Rentals in Elko, right? Hey, wonderful. They're members of the chamber. You now have an option for a new product. So you don't get the proactive outreach to all the individuals because the group has not given you the data. But as you have those members that were attached to the group, you can enroll them. But to your point, the other comment in that question, Doug, I believe, was people are going to outreach to your clients, right? So if another agent signs up a group that your client worked for and the group gives them data, yes, they will be outreaching to them, or they can, right? And they're not breaking any rules. So, I mean, most people, it's like, yeah, you want to be out in front of this. You remember, you want to get in front of the group so that you can get the leads and the referrals, right? And again, and any agent, if your client calls you and says, Colette, you know, so-and-so just mentioned this new product, say, oh, you know what? I'm so wonderful you saw that. I'm actually certified to sell it. I can help you. I haven't gotten to you yet. Wonderful, right? They don't have to change agents. They don't have to be forced through the person who signed up the group. You guys will help people, and they're your relationships.
So if we want to set up like a national association, would we come to you and you'd assist us with that, or we'll go set them up, or what?
Yeah, absolutely. We can help, and more than willing. Only so much bandwidth, right? Well, of course, you'll have other training with Stonehill and some other partners that we can help you with. But yeah, anytime we can help out. We're working, right? We've already met with the I think it was South Jordan, now it's South Valley or whatever chamber, right? We already have people working on the Salt Lake chamber, right? And we have multiple people saying, I've got the wonderful. Let's work together to get them signed up. And then you still have to go out to the individual businesses that you have relationships with. And that's where you'll work from that angle.
Okay.
Really large employers. It's kind of fun. I mean, we've met with some of the largest public companies that we use on a daily basis, and it's just fun. I never thought I would have something where we could meet with these companies. You're just like, it's just so fun. Gene, you had another question?
Yeah. Talking about these opportunities, I'm just wondering, where would you say you are saturation wise, both here in the Utah market, but other markets like the West Coast markets, East Coast markets, and so on?
Yeah. You guys are on, I think the invite said cutting edge. You guys are on the tip of the spear here. Like, Utah is the most, right? Because of some partners down there. But again, it's abroad. We'll get the chambers, we'll get the school districts. You guys have access to all those employees that you already have relationships with, right? But literally most employers, you guys are on the forefront of this. Nevada, we've done a lot in Nevada. I grew up there. Idaho is really starting to go. I just met with another national carrier this morning. I think I told you about that wants to start looking at this. So in the next 4 to 6 months, I think it'll be a lot different because of the movement. Back east, we have groups in New Jersey, Kentucky, Vermont, Texas, but it's not, no, it's wide open. I mean, you guys are at the forefront of this, and Stonehill is bringing it to you for the right reasons, I think.
So this is available nationwide.
Yeah. I mean, literally, that's what's so cool about it is because we're on the group chassis and it's a non-network product. We're in all 50 states, every county plus DC. You just have to be licensed in the state that the company is headquartered. So if you wanted to meet with Boeing, for example, right? Wonderful. Let's get Boeing signed up. You got to be licensed in the state of Washington, right? Wonderful. You want Walmart to sign up? They should sign up. You got to be licensed in Bentonville. Now, that's the fun thing about the Chamber of Commerce, right? Because, like, for example, in Elko, the Walmart Elko is a member of the Elko Chamber. So anyone that worked for the Elko Walmart, I can actually enroll in our product. Walmart corporate has not offered our product, but I can actually enroll those individuals. We got some flexibility on a group that's just so fun. I wake up every day excited. I mean, it's just so fun. Think of this. This is one of my favorite things to tell people. And if you guys are working from home, the next time you go out, but if you're working from an employer, from work, this is what I want you to do today. When you drive home today, or the next time you're driving, I want you to observe every business you can, every Maverick, every soda shop, every Home Depot, every Fred Meyer's, every Target, every mom and pop, literally every business that you look at is now an opportunity to say, you can offer something at no cost to you. And whether someone or not signs up is up to them. That we have no participation requirements. You're literally just giving them access to a product. There's nothing else like it. There's no other carrier that has, even United, we'll bring up United Healthcare. They don't have a product in every county, every state. It's just fun. And for you guys, it's not because this is the product that they should enroll in, right? Your job is to do what's right for them. Now, if you're in Ely, Nevada, you have two options. You either pay for a supplement or you purchase the MSA. But guess what? If you're under 65 and you're disabled, you only have one option now, and that's our MSA. Now, if you're on Medicaid, we can't help you. If you're on hospice, we can't. If you're a veteran, we can't help you. You have other benefits. But literally, it's like, this is a good thing for people. There's no downside. Every group should offer this. I tell people this is a perfect fit for every group, not for every individual. And there's lots of good Medicare products out there. People are like, Drew, why would I sign up for this when I could sign up for the Blue Cross Preferred plan and I get $2,000 of dental and I get, or no, I don't get over the counter anymore because they just took that away from me. I'm like, look, you may not sign up on our product over the Blue Cross. I'm assuming you're a good agent and you're going to do what's right for your client. But your client only gets $2,000 of dental if they actually go to the dentist. You keep our money, right? It's just the way the product works. Your job is to do what's in the best interest of the person. We want to give you access to more. Now, let me share with you.
Quick
Go ahead.
question while you've got the map up.
Yep.
In most cases, the Empire State has all their own rules. Do you run into any problems there?
Oh, New York, California, those are probably the two, right? Washington, Oregon. So on a group chassis, we get the federal waiver. That's what's unique, right? We don't, it's the state's not dictating, right? On our product, same commission schedules, right? Through the agencies, same 3 products available if an employer sponsors it. All 50 states, every county.
So I was bringing up,
Or no, I was just going to switch slides here to our sole proprietor deal, but go ahead and ask the question we'll talk about.
I was going to bring up Wyoming, for example. So Wyoming is a lot like Ely, under 65, disabled. They have no options whatsoever. They can't get the supplements. So what Wyoming has done is they've contracted with Blue Cross Blue Shield with a group plan that's super expensive, that most can't afford. This would be a great option for Wyoming.
Okay, let's run there. We haven't done a ton in Wyoming, Montana. you lead, we'll run as fast as you want with us. It'd be awesome. Then they should. And it's not because this is what people should enroll in, but I believe that they should have access to it. People are like, Drew, what's your vision of Fenyx Health? What I am passionate about is what health equity did for HSAs, right? Fenyx Health is positioned to be for the MSA. Every Medicare beneficiary in this country should have access to an MSA product. On a group chassis, we can do that, right? We can do that. The individual policies you had to grow by state, which you could do, but on a group chassis, we just have the flexibility. So I really believe, like, we want to be the HSA for Medicare. That's what we are. It is the HSA of Medicare with some slight differences. And letting people have access to it as an option, not because they should or need to enroll in it, but giving them action. We're all human beings, right? When you're looking at something, you know, you're most likely, when someone sits down with you, what do you typically say? Okay, what are all my options? Here you go. All right, we got another question here, hand raised. Go ahead. And
Hi. Hey, I was just wondering about solvency. If we went fast across the nation, fast and furious, are you able to keep up with those pre-billing finances? Are you solvent enough to do that? Or
yeah, thank you for bringing that up. So I'll share everything I can share with you without an NDA, okay? Which is enough, right? We sign NDAs with people that are investing money in big systems that want to take risk with us. But so we are venture capital backed, BIP Ventures. It's Bob, Indy, Paul. Used to be Panoramic. They're out of Atlanta, Georgia. They focus on healthcare. So they've got a long history, right? They have funds in the hundreds of millions of dollars, right? So as far as stabilization, we have that. Of course, we have other investors, strategic partners, you know, as we open up investment rounds for different reasons. We were required to carry, you know, 300% risk-based, our risk-based capital, right? We have 400%. We had to have twice the that the state mandated. I mean, the commissioner, when we actually started in Delaware, we've redomesticated to the state of Texas, but the Delaware commissioner, he wouldn't even allow us, he wouldn't even give us our license so we could start the process with CMS unless we had double the reserves that the state actually required. And we were like, what are you talking about? We're meeting all the requirements. And he's like, well, that's just what is required, but I can go above and beyond it. He just wanted to make sure that we had extra money. So we went and raised the extra money. Partner Re, this may mean something to some of you, nothing to some of you, it's fine. Partner Re is our excess loss insurer. You are going to want to know this if you talk to large groups and brokers, because they'll know all of these names. Partner Re is our excess loss insurer. Anything over $250,000, then they cover. Hanover Re is our quota share partner. We cede 70% to them, right? One of the largest in the world, right? Everybody, if you're talking to Gallagher, Lockton, Morton and Company, all these big outfits, right? The largest companies in the country, that's who they're using, right? They know those names. And then Milliman is our actuary and repricer. Those are the gold standard. I met with a Gallagher agent back in Louisiana one time, and he was like, I've never heard of Fenyx. Are you going to be around next year? I hope so. But when I told him Partner Re, Hanover Re, and Milliman, he literally said, how the hell did you get them? Like, you're effectively no one right now, right? You're starting out. And that's a testament to Jim Hanlon, right? To what he built with Lasso when he was there, what he did previously with Geisinger Health, what he did with United Health. And those people, they know and understand MSAs. It's very actuarially favorable. So do we always have risk? Absolutely. We're an insurance company. You know, we want to have enough people sign up to spread the risk, but as far as how we're structured, it couldn't be any better. And when you share those names with the largest companies and the brokers, it's like, oh, okay, So we're not required to have a Better Business Bureau rating because we're on a group chassis, but we get to use Hanover Reese because of our quota share partner, and we get to use their balance sheet. So pretty cool. I do want to share with you guys, and then we'll
So
keep
Drew,
going.
there's
There was a
there's another question in the chat box. It's kind of
Okay,
a
Nancy.
complicated one.
Okay, agent question. I understand that if the product is not a good fit, that you need a scope of appointment and to talk to the products. How will anyone be able to monitor those agents that reach out, determining that the product isn't the right fit in the state that they need to SOA sign? And Yes, yeah. This is where the bad actors, right? I wish I could tell you everyone was just wonderful, and the reason why we have a lot of restrictions, right? It's like, well, I won't bring up politics. I'm more conservative, but I won't bring up politics today. There are bad actors, right? And of course we want to be aware of that and weed that out. But in all reality, we don't know, right? We know that the group has signed up. We don't know if you're even reaching out to the people. That is between you and the group. If of course, if you see anything or find something that seems off, we would want to know about it so we can investigate. But even the groups themselves, not every group wants to share data, right? Even if you sign the group up, that does not mean that they have to give you their data. You know, they may say, Nancy, we think this is a good fit, and you clearly have a few people that work for us that would like it, so we'll sign up. We're not going to share any data with you, but as you get referred to other people and it's available to them, great, right? The employer doesn't even know if you've signed someone up, right? That's between you and the Medicare agent or the employee, unless they're involved with, like, we're taking Johnny off the group, right? They won't even know. That it's literally just a voluntary product that they've sponsored. Whether someone signs up or not is up to them and an agent. But yeah, any stuff that we see that may be going on, you got to get a hold of us. Now, this, I'm really excited to share this with you. And we may adjust the name on it a little bit. I just put MSASP for sole proprietor. On a group chassis, you can be a group of one. And to be a sole proprietor, when a group signs up, you have to have an active EIN number and you have to be registered with the state. So those are some of the things that you fill out on the group application form. Only takes about 5 minutes, and then we check active EIN, registered with the state. Okay, they're an eligible group. With a sole proprietor, it's a little unique. You are not required to have an EIN number. Right now, most sole proprietors are going to have something. They're going to have an LLC, an S corp, whatever it may be. But you are not required to have an EIN number, because it is you. You can use your social security number and you file your taxes. Now, you may have a Schedule C or Schedule F or whatnot, but we can actually have a sole proprietor enroll in this plan. There's not going to be a group application. It's literally just going to be an enrollment application because you are a group of one. And it'll state on the application that you're self-attesting that you or your spouse is a sole proprietor, you're following the IRS guidelines, and that Fenyx Health has the right to request documentation, right? We may want to ask for your tax returns or whatever. But remember, I told you that by law, we are not allowed to charge a premium to a beneficiary, but on a group chassis, we can charge a group fee. So if you're a group of one, we can actually charge you. And so we've set up this plan. It's a $250 group fee. We've lowered the deductible from $6,000 to $5,000. Over the course of 12 months, we're going to put $4,800 in your MSA. So effectively, you have a $200 max out of pocket. A little bit better than Plan G right now, right?
Wow.
How does it work? If you sign up in January, remember, we get $2,400 from the government because that's the plan we base it off of effectively. You give us 250, we take 200, we put it right back in your account. So you get 2,600 bucks. Every month you give us 250 bucks, we give you back 200. So for 50 bucks a month, especially if you had an HSA before you retired, you're going to love this plan. And if you're a sole proprietor, you just fill out the application, sign up, and you're enrolled. And this is launching literally in how many days? 7 days. March 1st is our effective date. This is exciting, guys. This is exciting. You could sell You could
That
sell,
blows me away. That blows me away.
you could sell thousands of these. This is so exciting. Like I'm probably most excited about this. I think this you have 100% control of. Think of all your supplement people right now that are sole proprietors. And if they stop working, right, think of it like life insurance. Once you've signed up, if you stop working and you're no longer a, quote unquote sole proprietor for tax purposes, you do have to be an active sole proprietor when you sign up, but after that, it's fine. Like literally it's fun. So this is what I'm most excited about. And then our small group strategy, especially if you're working with group agents, super excited about. And then of course, anyone, like literally any size group, but fun ideas to get you in front of a lot more people. Another hand raised.
Yeah, just to understand this a little better. So if I'm a sole proprietor, I'm going to pay $250 a month. $200 goes into my medical savings account. And so basically it's costing me $50 a month for an insurance policy.
Right.
The $250 that went in was pre-tax, and the $200, as long as I spend it on medical, is no tax. But if I take it out at the end of the year or after I've accumulated for several years, then I would pay tax on it at that point.
Correct. You follow the IRS rules, right? So publication 502 and 969 are the qualified medical expenses, right? So if it's not a qualified medical expense, then between you and the IRS is the tax consequences. But yes, the power of this, Gene, you were the one asking the question, right? I think so. The power of this is especially if you were an HSA, right? Why do we think this is going to work good, especially in the Intermountain West, HSA capital of the world, right? Is those individuals now have a way to continue to fund the most tax efficient vehicle known to man. That's an HSA for Medicare, right? Pre-tax, gross tax-free, comes out tax-free for qualified medical expenses. There's no other vehicle that does that, right? That's what's powerful about HSAs. And then you are forced to stop contributing when you're Medicare eligible and you enroll in Medicare. We now have a solution. And if you're not a sole proprietor, you can still sign up for our standard plans and get the $2,400 or whatever, literally get the money. It's the only Medicare product you can actually earn money on from Medicare, right? It's not use it or lose it, but this is going to be powerful. Think of this. Think of all your attorneys, right? That usually have their own LLPs. Think of the, like when you sign up an association for groups, it has to be employer related, right? This product though, however, think of the Association of Realtors. They're all self-employed. They're all 1099. Think of agents, right? I mean, Stonehill. Think of all your agents that you work with, right? That are sole proprietors. It's like, you guys now have a pretty cool, I think agents, like most brokers, when I show them this, they're like, this is the plan I'm enrolling on when I'm eligible for Medicare. I have the flexibility of a like supplement network. I have flexibility of Part D, which by the way, we can also do group Part D. So we work with Benestar, we work with OptumRx, we're developing some stuff. So we'll have some trying to develop a off the shelf deal too. But, a lot of people, WellCare $0 right now. So we can do some fun stuff. I'm really excited about this plan.
So everything we've looked at is for those that are eligible for Medicare. We don't have anything at this point available for under 65.
Well, under 65 if you're eligible for Medicare, because this is Medicare Advantage. Yeah, we don't have any, because the MSA is a very specific it's Medicare MSA. It's not, so there are Archer MSAs, right? States have MSAs. You get tax breaks for state stuff. I want to say, which IRS form is it? I want to say it's like 88, if I remember right, 8853 talks about the Archer MSAs. Medicare MSA is a subset of that. So when some people refer to MSAs, it's like, this is specific. This is Medicare MSA. You have to be eligible for Medicare for it.
Thank you.
Which you're no longer allowed to contribute to your HSA. I do like the question, is Bitcoin a method of payment? As of now, no. So the way we're going to structure this, the sole proprietor is it'll be an ACH, no credit card, no debit card. It's got to be routing an account number, so you don't have to deal with cards getting denied and all that stuff.
Is this available to the spouse of the sole proprietor?
Correct. Yeah. So all of our plans, right? So standard plans, any eligible employee, their spouses and or dependents that would be eligible for Medicare. So yeah, if you're a sole proprietor, and that's the difference between an HSA and an MSA. An MSA is an individual account. So the spouse and the individual would have, it'd be two separate MSAs. You each have your own debit card. You each pay in, it's $250 a month. We give you back 200. So any per person, right? Yeah.
Okay.
On this plan, yeah. So, but you each get 200 back, right? Another question is, are there any downsides to this program? I would use the word more limitations, right? There's limitations in every product, right? Insurance in general, right? Always has to have limitations. So we are limited to what Medicare will pay for. If you're a non-Medicare participating provider, right, it's just not there, right? If you are Medicare participating, but you don't want to accept our product, can you still go there? Absolutely. Can you get balance billed 115%? We just follow Medicare rules. Really, the only limitation that some people have said, hey, this was a little rough starting out with, is the doctors and the hospitals not recognizing it. And so it wasn't as smooth as just walking in and saying, okay, thank you for your insurance. Now, we're doing all we can to get ahead of that. One, by working with health systems ahead of time, or if you tell us ahead of time, let us communicate. So the first time you meet with them is not right when you walk in and they've never seen this card before. But literally, this happened with Lasso. 95% of the time, they still take it. I mean, I haven't talked with St. Luke's at all, and we haven't had one denial. They've processed every claim that's come into them. They're just, okay, oh yeah, we get paid. Okay, let's process it and see. So it's just different systems are funny, but we want to be ahead of that and do as much as we can. Yeah, doctors and hospitals specifically, you know, I don't care who they are, right? They do not like Medicare Advantage, except for the ones that have their own product. Magically, their product is better than everyone else, right? It's because of the games that are played, right? It's the prior auths, it's the referrals, it's the contracts that they're supposed to be getting paid. This is why, Colette, I think we talked, so critical access hospitals, even if they have a contract with the Medicare Advantage payer, it's the prior auths, the referrals, and then they don't come back and pay them the all-inclusive rates, even though they said they would. And then, you know, the carriers, like United's like, okay, well, what are you going to do? You know, I'm like, we don't have to play any of those games. This is where it's really unique. It's think original Medicare, and doctors the same way. It's how am I getting paid? So the focus is, do you accept original Medicare? Yes. You're going to love this product. It's going to pay you 100% of Medicare. You're not even collecting the deductible. But they have to send us the bill. It's not Medicare, it's us. And we're right now, you know, we have 30 days to run the claim and to get them paid. It's on average, we've been paying people in 14 days.
That's awesome.
They get paid pretty quick and they're not even sending the bill to the patient.
That's
awesome.
Great. Yeah. So is that fee, the group fee, is it $250 for the enrollment fee for the year, or is it monthly?
No, that's monthly.
Monthly. Okay.
Yeah, so that's every month you pay us, then so January, as in this example, you get 26 because we gave you 2,400 from the government, plus we took 200 of the 250, and then every month you pay us 250, we put 200 back into your MSA. So at the end of the year, you got $4,800. Okay. And the other reason why we're offering the financial support, right? Something happened early in the year, you don't have all the money in your MSA quite yet in this plan, right? So it's just been good. Yes, we do have a customer service department. I mean, we are small, right? There's 8 of us right now. We have the ability to, like I said, you guys are kind of on the ground floor here. Okay, we'll be fully transparent. We have 330 members right now. With the sole proprietor coming out in March, with the small group launching, with all the stuff we got going on across the country. I mean, we had a group in New Jersey, right? They have 10,000 retirees on their supplement, and they're looking at moving to our plan, all 10,000 at once, right? Census enrollment. You know, the agent's pretty excited if that actually goes through, right? So we can just do some things in different areas where they could save hundreds and millions of, I mean, they could save hundreds of thousands, millions of dollars in savings. We've already had some groups do that. And no, there's no discount annually. It's just set up monthly.
If an individual is okay, now this MSA, yeah, this sole proprietor plan is only for sole proprietors, not partnerships, not small companies. It's just simply sole proprietors, period.
Correct. Yeah. So with other companies, right, partnerships, all that stuff, they're eligible for our standard plans. But keep in mind, Craig, most people have like even partners, right? They've got real estate, or they're doing something here, or their wife's selling candles. There's nothing wrong with selling candles. Right? It's wonderful. Like literally, it's in most cases, if you're a business owner, you've got something in your portfolio where you are considered a sole proprietor, basically, right?
So if the spouse that is the sole proprietor is under 65, not on Medicare, just on regular medical health plans, but they have a spouse that's over 65 who is eligible for Medicare, can they do this on just the 65 plus spouse?
Correct, because in the application, it's asking if you or your spouse is a sole proprietor.
Okay, cool.
Yep.
Cool.
Yeah, and then when you offer it, then your spouse or dependents would be eligible for it.
Okay, cool. Thank you.
Yep.
Drew, slightly off of the topic just a little bit, but what about I'm traveling, I decide I want to go to Europe for a couple of months, and I fall and I break an arm. What happens in those cases?
Same thing that happens with original Medicare. So that is another disadvantage, I guess you could say, with us where a supplement, right, could help out there. But we just follow Medicare. In most cases, I mean, I tell people travel insurance is, and I'll use United as an example, right? It's so easy to jump on and not deal with who's going to reciprocate, who's going to pay for this or that. I mean, there's a story right now, some guy in Idaho Falls that broke his neck, skiing in the Alps, and United's unwilling to pay for his rehab and stuff. I'm like, if you're traveling a lot, then maybe it's not the best fit for you, right? Maybe you do want to supplement. But we just follow original Medicare. But the travel insurance, then you don't have to worry about all that crap. It just covers it.
Okay, we are going on 2 hours here. So if it's okay with you, Drew, can I call a halt to this?
Yeah, I was just going to mention, because Brenda put it in the notes, Geo Blue with Blue Cross. Yeah, United, and then Geo Blue with Blue Cross Blue Shield. Their travel plans also does really good.
Okay.
Yeah, I'm here for you guys. Whatever questions you have, if we need to talk more, like I said, we're here to help. There's a lot more information when you do the product certification. I'll just kind of show you if I scroll down here on the side. You can see all these. I mean, in this presentation, there's almost 50 slides. So lots of questions about, how does the financial support work? How do we get paid? What's taxable, what's not? This is all going to be, this is like our certification exam here. And so just a plethora of information. Here's what shows you how much you get paid if you enroll in a certain month, right? And then of course I've got some basics of Medicare here, because a lot of times we present to brokers that don't sell Medicare, and so we've got to explain the basics of Medicare to them.
So can you stop sharing, and I'm going to show where our Fenyx repository is to agents real fast as I make 4 points here. So I just wanted to show you this. So this is www.medicareplandetails.com. I've talked with all of you about this before, And you can see this, it's got all of the carriers that you can get. Here's Fenyx right here. If you go into Fenyx, and we're going to post the stuff that Drew has shared with us, you can see the spreadsheet that he was using and showing you earlier. That is out here right now. There are brochures, there are things that you can look at, and we'll be putting all of the stuff out there that he sends to us that you may want us, that you can ask us to put out there so that you can store it out there and keep it out there. We try to keep it up to date. Anyway, this is there for you. It is behind a password. The password is Advantage with an uppercase A. We have had one agent who has gotten contracted during this presentation because Drew did such a good job talking about this. If any of the rest of you are interested in getting appointed, please send Nancy or me or anyone else here at Stonehill a note, and we'll get the contracting sent out to you. We are recording this. We will be posting it probably Tuesday or Wednesday out to YouTube and putting it out here on MedicarePlanDetails.com as well. And I think that's everything I have to say. We're very grateful for the time you spent with us, Drew. I did not know that sole proprietorship program. I was blown away.
Yeah, no, I was excited to share that with you, and I appreciate the opportunity. The other plug I'll put in for you, Doug, here on this stuff, we are creating some flyers, like a 1-2 page flyer with a video specifically that you can send to a group broker, that you can send to an employer, that you could send, like literally it's the email template will be all designed for you. Stonehill will be able to get it to you where you can just send it to the HR person and they can watch the little 3-minute video that kind of gives them the overview, and then they can call and say, hey, yeah, let's get together. So trying to give you some more resources to be able to just send it out so you don't have to try to explain it all until you learn it.
Oh, so so I hope that most of you have received a text message from Stonehill about a new Medicare group producing program that we are starting. This is a good introduction. This shows you the potential of the program. And I hope that you will take it seriously, the invitation. We are asking for people to jump through a few hoops just because we have so many people start programs and then not actually have the willpower to stay in it. So we are asking you to jump through a few hoops where we will be giving you lots and lots of support, including a group mentor, someone who can help you understand how HR decision makers think and how to talk with groups and decision makers. And thank you very much for joining.